So we're progressing through our doctor's ABCD. We've looked at danger, we've looked at response, we've sent for help, we've assessed the patient's airway, we've looked, listened and felt for breathing, and now we're considering that the patient is unconscious, unresponsive and not breathing, that we might need to start doing CPR. Now CPR is cardiopulmonary resuscitation, so we're trying to assist the lungs and the heart to function until help arrives. This is basically just maintaining the casualty until the ambulance arrives and offers secondary help. So with our casualty here, we've got them on their back. We're about to start CPR. With an adult, we've got the head in the full tilt position. I'm going to pinch their nose and I'm going to use a pistol grip to open their lower jaw so that I can have access to their mouth and airway to assist them with rescue breathing. Rescue breathing is optional. It is preferred to do because you can provide a substantial amount of oxygen for the victim if need be, but the mere fact of you doing the compressions on the casualty will create like a vacuum effect within the chest cavity, and it will actually still draw air and oxygen in from the ambient environment in between compressions. So air will actually still be getting into the patient's lungs during compressions alone. So if you don't feel comfortable doing the rescue breathing, then if you're doing adequate compressions, that's enough. So I'm going to be using my PPE whilst doing this demonstration so you can see how it functions. So I've got the patient's head in a full tilt. I've pinched the nose. I'm putting the face shield over the top. Now you don't need to do this as aggressively on an actual human being, but for the purposes of the mannequin, I'm going to push the mask into their mouth a little bit. I'm using the pistol grip to hold the lower jaw and open the mouth, and then I'm going to cover their entire mouth with my mouth and create a seal. I'm pinching the nose so that air doesn't escape out of the nostrils while I do this, and my objective is to get the chest to rise and fall. So let's see how successful I am. Okay, so that was relatively successful. You could see the chest rise and fall quite significantly. Now, because this is an adult, I was doing 2 full breaths. My lung capacity is similar to the victim's lung capacity, so I'm trying to equal that in an adult situation. With a child, their anatomy is obviously a lot smaller, so I would be considering doing a half breath with them when I'm doing the respirations. And with a baby, because they are much smaller again, I would only be doing little puffs. So I'd be filling my cheeks with air and doing puffs into them. So and with an infant, because their anatomy is a lot smaller on their face, I'm not needing to pinch their nose. I can actually cover their nose and their mouth with my mouth and get a good seal. So it would go over the whole area. Head in a neutral position, 2 puffs. So the next component of performing cardiopulmonary resuscitation is the chest compressions. So I've shown the breathing, and now I'm going to move on to show you the chest compressions. With the human anatomy, the heart lies within the chest cavity, a little bit over to the left-hand side, but pretty much underneath the sternum or the breastplate or breastbone. You can tell where the sternum is because you can measure it from what's called the sternal notch, which is this little groove at the base of your throat, and the xiphoid process, which is the pointy bit of bone that just sits in there underneath your ribs. Now your ribs attach to this breastplate, and it runs vertically down the centre of your chest. So we're aiming to do our compressions on that breastplate. It provides us with a solid surface to push down on the heart. Now, in a situation where you're doing compressions, you want to have the victim on a hard, flat surface so that you are actually creating a compression. Okay? If the person was, say, in water or on something soft, if you're pressing on the sternum, you're only going to be pushing the person down. So you're not actually going to be compressing, you're just going to be moving their whole body. So hard surface, very important. If you're doing CPR on a child or even a baby and they're in your arms, you need to make sure that that bottom surface is very firm. Some people may put them on their laps, some may put them on a table or a bench. If you're travelling in a car, for example, you might put them on the Melways street directory or on your iPad, just so long as you've got a flat, firm surface underneath them when you are performing CPR. So we're going to be locating the area on the chest where we're going to be doing the compressions. So I've looked at the sternal notch and the xiphoid process, and I can tell that the sternum is running centrally between those 2 points. Now, the easiest way to access this midline point is to put a hand in the person's armpit or axilla and just move it across to the midline. Okay? So I'm wanting the palm of my hand or the ball of my hand to be on that midline. I can feel the sternum underneath where I'm going to be compressing, and this is the strongest part of my hand to be doing the compressions. On an adult, I will be using 2 hands, so I'll interlink another hand on top of that so that I can get the best amount of pressure possible. I don't want to be doing it from this angle because I'm going to be pushing inadequately with not enough force. I want to be up and over the patient with my shoulders directly above their chest and my elbows locked and straight. From this position, I can adequately compress the chest to the desired 1/3 level. So I'm just going to show you 1 or 2 compressions just to show you how aggressive, for want of a different word, you actually need to be to get a good full compression. So here we go. When you're doing chest compressions, it can become very tiring. In an emergency situation, you are going to have adrenaline running through your system, which will offer you the extra energy and ability to continue with your chest compressions for a lot longer than you would think possible. In terms of maintaining the rhythm and rate with this, you would be doing 30 chest compressions to 2 breaths. Now that's the same for every age group. So 30 chest compressions to 2 respirations. So you'd do your 30, then you'd come, you'd pinch the nose, tilt the head, pistol grip for the jaw, and then you'd find your midline again. Twenty, 22, 3 to 4 to 5. So you continue those rotations until one of a few things occurs, that the patient becomes responsive and wakes up, that help arrives to assist you and they take over the compressions. If the people that are helping you from the ambulance or medical team declare the person deceased and ask you to cease with CPR. Another one is if you are physically exhausted and cannot continue anymore. And the last one is if the danger returns to the environment. So, I don't know, say for example, as we'd mentioned earlier about traffic situation, if traffic becomes an issue and that again, that you would stop, maybe relocate and commence as soon as possible. So they're the 5 conditions that, the only reasons that you would cease CPR. So with the CPR, you notice that I was actually compressing the chest quite rapidly. We're wanting to aim for between 100 and 120 beats per minute, right across the board. This will cover all age groups' heart rates to make sure that they're getting adequate blood supply through the heart and adequate oxygenation to maintain life. Right across the board in age groups too, we're aiming for a third depth of the chest cavity. So in this adult person, you're looking at, you know, a good third there, a good couple of inches. With the child, a third again. So, you know, a little bit shorter, but still looking at that third difference. In Bubby, a third as well, obviously a lot smaller. Now with the adult, I'm using 2 hands for my compressions. You're needing that because they're a larger anatomy, it's a little bit firmer to push through the sternum to compress the heart. With a child, because their anatomy is slightly smaller and less mature, you would only be using 1 hand. You'd still be finding the location exactly the same way from the armpit through to the midpoint, but you would just be doing compressions like so, a third. And with the palm of your hand, okay? With little baby, because they are a lot smaller with their anatomy and that, you'd only be using 2 fingers to compress their sternum. So finding the midline and doing your compressions like so. Now, a good way to remember the rate and rhythm to be doing compressions with is if you think of the Bee Gees song Staying Alive. That sort of quick rhythm is always a good one if you get that in your head to keep the rhythm of your compressions going. Important to note that when you are doing the 30 and 2 ratios with your compressions, on that 30th compression, try not to do the big heave-ho push-off. Usually when you do that as the grand finale to your set of compressions, that's usually when you end up causing injury to the casualty. You may fracture a rib, that fractured rib may puncture the liver, all sorts of things can go on. It's important not to stop CPR, even on a person who you think you've fractured their ribs or causing internal injury. Those kind of things can be repaired after the event in hospital, but it's really important for you to maintain that blood flow and maintain that person's life until help arrives. Okay, it's important with CPR to remember that any attempt at CPR is better than no attempt at all. Even if you think that you are not adequately doing the breathing or doing the chest compressions firmly enough or deep enough or at the right rhythm or rate, anything that you are doing to help the casualty is going to be of benefit to them. It's really important that people understand this and know this, because performing CPR is such a valuable and beneficial skill for people to have, and you never know when you're going to need to use it.